Welcome back to Your View.
Thanks for staying with us. So we have Dr. Japheth Olugbogi. He's the chairman committee on COVID-19 for the Nigerian Medical Association Lagos branch to share with us updates on COVID-19. My first question to you, sir. I've been trying to ask this question, for nobody's been able to answer this question. We keep saying, even globally, that X number have recovered. Please, what did they use for these ones that recovered? Because we need information, and I feel that we're not decentralizing this information.
Yeah.
You cannot keep hoarding the information that you're using to make these people well. Let us know what you did that they recovered, what they did that they recovered, such that we can also protect ourselves.
Well, thank you very much for having me. First of all, COVID-19, as we are all aware, doesn't have a cure for now. Although I'm hearing that there's a vaccine in the US that's been developed. But those who recovered in Lagos, 2 patients precisely,
Okay.
They were managed symptomatically. That is to say that we must bring on the symptoms, they manage them for their symptoms.
Okay.
So, but at the end of the day, we gave them 2 particular antivirals, which I'm not at liberty to disclose for certain reasons. And they did well on those antivirals, and it helped them to keep their viral load low until they got so much better and then tested negative, and then we had to discharge them.
Yeah,
okay.
so I am worried. Okay,
You're the go-to person in COVID-19 Lagos for all information, because the reason I'm asking is that recently there have been many figures that have been posted on social media that are saying that these are the right numbers, that maybe the government may be, may not be telling us exactly how many people have this COVID-19. Could you tell us exactly how many people have it, how many people were looking for, who may have come in and they did not, come in on some flights that we had cases, but they have not yet reported themselves?
Well, thank you very much. First of all, I think I'd like to discountenance some rumors that are going on in society. The government is actually very truthful because I can say categorically that as the cases come in, as the results come in, the government rolls out the results as much as possible to the populace. You are right. Last night I posted on a group that I'll be here to this morning, and somebody questioned, what are you talking about? Is the government, is it COVID-19 or COVID corruption and all that? So a lot of people still don't believe that we actually have cases in Lagos. And some who think the government is hoarding the numbers. The government is not hoarding the numbers.
Okay.
We have just 40 cases.
But people believe that it's 40 cases that you know. But there are plenty that you don't know, that have not come forward. So telling us 40 for us, we are still wondering, the 3 flights, Turkish Airlines, Lufthansa, and BA.
How many people are
inside? So we've not heard any. So for us, we are worried.
You may not be too far from the truth, but that is half truth, if I may say.
Okay.
Yes, we have tested 40 people that are positive.
Okay.
But yes, we are also monitoring and tracing certain other people who may have been in contact with the 40 people that we've tested,
right,
who may have been on the same flight with them.
Right.
But that does not mean that they actually have the disease.
Okay.
Now, it is true that there are asymptomatic carriers. Now, but
what does that mean?
Yes,
Please, Nigerians need to understand. What does asymptomatic carrier mean?
Asymptomatic carriers are those who actually have the virus, or who may have had the virus, but are not showing symptoms yet.
Okay.
But research has also shown that these people are actually fewer in number, and they don't infect as much as people who actually show symptoms. Let me repeat that again so that everybody is clear. Now, when somebody has COVID-19, the incubation period is 14 days.
Okay.
So if you start showing symptoms, that means within the 14 days, that means that person, when the person actually tests positive for it, that person has COVID-19.
Right.
But that person can easily disseminate the virus to others.
Okay.
There are some others who may actually be within that 14 days period, who may not be showing any symptoms at all.
Okay.
And may have the virus.
Okay.
Okay, those are the asymptomatic.
And can you catch from those people also?
We can catch them if we do our contact tracing. That is to say,
So can those people spread?
Yeah, spread.
they can spread it, but like I said earlier on, that was what I was trying to emphasize. Not as much
as
those
those
who
are
are
showing
actually
symptoms.
showing symptoms.
Oh, fantastic.
So that is one strength that
Okay.
we are using to actually pick up people.
Go ahead.
But they may not be far from the truth that some people are in the society which we have not picked up, because as much as possible, we are trying to test as many people as possible to be able to pick them up and then put them in isolation.
Lagos State has been telling us that they are ready for this COVID-19, They already have 100 beds somewhere in Yaba as we speak. But is this not false hope? Are you telling us the truth? Because we need to know, I believe Nigerians or Lagosians need to be aware of exactly the situation where we're in, because if you don't know you have a problem, you will not know when you get cured.
Absolutely.
Exactly where we're in. Are we equipped to handle this? For instance, the primary health care, we are still buying gloves when you go there. We had colleagues who went there 2 weeks ago. I don't want to mention the names, but people are still buying, still buying hand gloves to handle just normal cases. What if an outbreak happens in a place like Lagos? Are we sure we can contain it? Tell us the truth. When we have the truth, people will not insist on staying at home.
Right. Yeah, go ahead.
Well, thank you. It's regrettable that people still have to buy gloves in the particular primary health care. But what I can say for sure is that that should be out of the place now. That should be a forgotten thing, because the government actually provides consumables, and the medical officers of health, which I am one, also as much as possible, they are the MDCO of those primary centers, and they ought to provide consumables as much as possible. Now, the government has about 100 beds, I'd say about, in the Yaba, because when the push comes to shove, you can't keep 100 people in 100 beds because of social distancing.
Yes, exactly.
But government have about 100 beds in Yaba. But like Dr. Aguro said earlier on, there are facilities in 5 different locations in Lagos, Badagry,
okay, let me just ask you.
Government is actually, let me finish that line of thought. Government is actually making more provisions so that people can get isolated in a befitting environment as much as possible.
Issue of testing. Now, how many test kits does Lagos State have? Because globally, everybody's complaining that they don't have enough. So I think it is our Sheshere Nigeria and even Sheshere Lagos. How many test kits do we have? And can we, if we now get these other hospitals to partner, can they be empowered with these test kits so that people who are feeling like I don't want to go to Yaba can comfortably go to the next hospital down the street and get tested?
And let me just add on that, how many testings are we doing per day in Lagos State?
First of all, I will not lie to you. We don't have enough test kits. Just like every other country in the whole world.
Yes.
There are not enough test kits. The test kits are expensive, they are difficult to handle, they are technical. Then apart from that, even if we do have test kits, we can't test everyone because we don't have enough human resource to carry that out. Now, even if we do have enough human resource to carry that out, they need to be trained. People who do the testing need to be trained. Don't forget that for somebody who is showing signs of COVID-19 and you want to test, the individual who is testing is also at risk. So the individual has to wear the PPE, the mask and all that. So
with that means that we might not even really know the real figure. Yes. Since we don't have enough test kits, we might not even know the real figure we have in Nigeria. Because we can't test anybody.
We may not know the real figure, but we are monitoring as many people as possible. Okay, for instance, the last time you asked a question that how many people are we monitoring? I don't have a particular figure right now, but we're monitoring over 5,000 people as we speak. People are calling.
5,000 people that we cannot test.
As we speak, people are calling.
5,000 people that we cannot test.
5,000 people that we cannot test. But for any one of them that shows symptoms, we test them immediately. And now, to answer your question,
how many?
I cannot say categorically, but I know for sure that we test over 25 people per day on a daily basis.
Go ahead.
Yes, so, you know, when I watch Nigerians, a lot of them are not taking this matter seriously, especially in my area, the very rural areas. They don't even understand what you're saying as we speak. So what do you think the government can do? Because when I watch international media, what they do is, for those people who are recovering, they go to the hospitals, they show them, explaining their pain, their experiences. Do you think the government can partner with media houses to go to the streets there?
Absolutely.
Let me add to that because also, what is the local government doing in addition to what she's saying to sensitize? Because we go to the market areas. So this is the time that we need local government to work like local government because they are the closest to the people. What are they doing to ensure that the motor parks are decongested? The markets, they are the ones closest to us.
Thank you very much. We can go on and on and on. That question you asked, I can talk about it for like an hour because I'm actually at the center of it. I work, I'm like the MD, CEO of primary centers at the local government level. So the responsibility falls on people like us to actually sensitize people in the community, and we have been doing that. As we speak, there's a lot of community dialogue going on. I personally did stakeholders community sensitization with DPO, police, CDC, CDA, community women, market women, everybody in attendance. We have pictures, we have a lot of jingles. We also rolled out on radio, in Yoruba, in local language, and even in English. A lot of IEC materials, flyers, even e-copies as well. So we are still doing a lot, but we want to partner with the media houses, and that's one of the reasons why I am here. I was actually sent here by the EOC, the Social Mobilization and Risk Communication part of the EOC, to actually talk to people on the media. We have been doing a lot of media engagement as well. We have appeared on radio a lot. And we are still doing a lot.
Yeah, I just want to ask one question. Because we have the situation that we have with markets, is there anything you would like for them to do while they're doing their business?
We should all take responsibility.
Wear gloves and masks? Because I say a lot of those do that.
I wouldn't advise that they wear gloves, because if they wear gloves, they're going to spread anything onto other people, because they don't know how to handle gloves. You can't wear a pair of gloves and use it to do everything you want to do in one day. You end up spreading germs to other people. So they should just wash their hands. If they don't have a hand wash basin and water and soap, use hand sanitizer. And it's not everybody that needs to wear a face mask. It's only people that are coughing or that have asthma or that live where there's dust or that in an environment where there's fumes and dust. So those are people that need to wear face masks.
But we do like to see local government chairman. If we don't see your faces, this is time for you to start working.
They are releasing money for sensitization.
No, it's not releasing money. It's not. We want to see them. We want to see them.
Okay, yes.
We want to see them in action.
See you on the streets, taking charge of your local government.
Talking to your people.
You're working, not that they are sitting
I think we can do that.
Okay, that's all we can take on this. Thank you very much, Dr. Japheth. We're going to bring you back. I hope you are going to stand by for us, because we continually want to know what's going on, especially in those holding centers, to be sure that we are monitoring those who are recovering and seeing that we're doing the right things to keep our immune.
And if you don't mind, I have 10 seconds to give a message to everybody. We are all in this together. People who have big hotels should also volunteer to government.
Thank you.
So that the government can use them as isolation centers, like quarantine centers. Government needs a lot of support now. It's not only government, Also, private organizations who have resources should also, as much as possible, help.
We'll bring solidarity. You have a long time. We'll bring you back to give us more updates. Don't worry.
Thank you very
That's
much.
all we can take. When we come back, the government has said they've closed borders. But what does that mean? You know, this Nigeria, you still use one way to enter the border. So we're bringing in somebody to help us explain how they're going to ensure that borders are properly closed. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.